Okay, so the question is: a female of 20 year presents with increasing weight, irregular menstrual cycle, examination. She has hirsute, blood pressure is increased 160 by 100, height is 5 feet, weight is 60 kilogram. Investigation: blood sugar is 200. Most likely diagnosis is Cushing disease. Diabetes mellitus will not be there because hirsutism, hypothyroidism will not present like this. Obesity does not provide such a scenario. Cushing disease is classical presentation because patient has hirsutism, blood pressure is increased, irregular menstruation, increased weight can give clue of Cushing disease. Another question is: a 40-year-old female present with complaint of bleeding, painful bleeding per rectum. Pain is so intense she is afraid of moving her bowel. Examination shows severe tenderness over anal region. What is most likely diagnosis? Most likely diagnosis is anal fissure because she has bleeding, she has pain and tenderness on examination at the site of examination. So she has anal fissure. Fistula and ano does not present like this. Hemorrhoids it has its own classical presentation, and perianal abscess does not present like this. So in this way, patient has anal fissures. A 4-year-old child is suffering from cystic fibrosis and complain of night blindness and photophobia. It is indicated by the deficiency of cystic fibrosis. Having night blindness, photophobia indicates deficiency of night blindness is caused by no deficiency of ascorbic acid. No thiamine is not there, pyridoxine is not there, but it is retinol. Retinol is essential for night vision, and its deficiency can cause photophobia and night blindness. Another question is: a young man had a road traffic accident, presence with the accident emergency department. Ipis Texas means bleeding per nose. Bleeding from nose is there, bruising, edema, tenderness on right ethmoidal region, anterior posterior nasal. Packing is not controlled. Ligation of which artery is best option? Ligation of ethmoidal artery is best treatment for epistaxis, not external carotid. Internal carotid does not ligate, is not ligated or maxillary, but uh, the ethmoidal artery is ligated. Another question is: a 20-year-old male is prescribed nicotinic acid for hypercholesterolemia. Yellow discoloration of sclera is there. Investigation shows hemoglobin is 11, serum bilirubin is 3, and direct bilirubin is 0.8 milligram per deciliter. ALT is 35. Most likely causes of jaundice is drug-induced hepatitis, Dubin-Johnson syndrome, or Gilbert syndrome. Gilbert syndrome is the uh, Gilbert syndrome causes jaundice in this patient. Another question is: a primary gravid with prolonged laboratory uh, lithotomy position, unable to walk properly after delivery, and she could not dorsiflex her right foot. Nerve most commonly damaged, which causes the problem of dorsiflexion, is common peroneal nerve, no compression of sacral plexus, no deep peroneal nerve is the nerve for dorsiflexion. So deep peroneal nerve is compressed. Sorry. Another question is: a 40-year female present in emergency with history of slipping from the stairs. She tried to hold railing of stairs by left hand, complains loss of some function of her left hand. Examination shows wrist and finger flexion are weak. Intrinsic hand muscles are paralyzed. There is sensory loss on the ulnar side of foramen and hand. What is most likely site of the lesion? Most likely site of the lesion is C8 to T1. Another question is: a 2-year-old boy has undergone uneventful elective herniatomy. You are asked to write his fluid and electrolyte requirement until he is allowed orally by mouth. What should be taken into account while calculating fluid and electrolyte? So for calculating surface area should not be taken account. Height, centimeter, time, duration, weight in kilogram is important for the fluid electrolyte. A 73-year-old undergone left-sided chest tube intubation for traumatic and thorax. 15 days back develops high-grade spiking pyrexia. Last 4 days chest tube shows drain of Frank first city reveals dense loculated collection confined to lower two-thirds of the chest. Most appropriate management of the patient is placement of new chest tube, installation of fibrinolytic system, thoracotomy, and decortication is most important, which should be done.